Ndukwe. I am the founder of a nonprofit organization called Better Way Passage. And with Better Way Passage, what we like to do is to really hone in on healthcare back home. Our efforts are focused on bridging the gap in wellness and prevention through medical education, training, and technology. The ultimate goal of our organization is to build multi-use medical simulation and training centers throughout Nigeria, hoping eventually throughout Africa, to empower clinical systems and the overall economy. I think the common theme that we've had amongst all the speakers here are how innovation, how can we innovate to make the country better? I think one thing that Dr. Remy said, if I recall correctly, is how analytical the woman's mind is. It's actually clinically factored, how analytical our minds are. And one thing that came across as me, I'm not clinical by trade, but came across to me just having experience with the healthcare systems is the need for training in simulation-based centers. Having that hands-on experience is really how we can bridge the gap in clinical systems. So before moving into my topic, if anyone is interested in hearing more about the organization, feel free to check out our website, bwpinc.org, or follow us on LinkedIn. Now, as previously stated, the focus of my topic is bridging the gap in healthcare leadership. And in going into that, amongst the many women that I am on this platform with today, I want to acknowledge a few, as I like to call them, bridge gappers, working to lessen the healthcare disparities between countries like Nigeria and the US or the UK. The first one we have is Temi Giwa Tubson. She is the founder and CEO of Life Bank. Life Bank is an organization focused on giving life-saving blood transfusions in Nigeria to individuals who need it, which, when we live in what we call developed or established countries, it's something that we take for granted. Next person we have is Uche Blackstock, who is a U.S. trained physician focused on racial disparities in the clinical field, really highlighting what has been going on, the microaggressions that women face in the clinical field, and how we can change for the betterment of the future, not only in the US or the UK, but globally, how we can bring equality into clinical care. And last but not least, we have one of my dear friends, I like to call her my accountability partner, is Vanessa Adebayo. She is the founder of Africa's Mental Health Matters. And what they do is focus on bringing awareness and prioritizing mental health in different countries in Africa. I think with the global pandemic, we can see how important it is to be on top of our mental health and really make sure that we're prioritizing ourselves in all aspects of healthcare. So now we're moving into my topic. Healthcare has been a major topic over the last year with the global pandemic. I think we've heard about COVID a couple of times throughout the conference already, but it's something that is continuously affecting us in various countries. However, in Africa, we haven't really been having much. It hasn't affected Africa as much as we would have expected or one would have expected. Now, this could be for various reasons. It could be for lack of data collection, individuals looking to tackle the virus in the privacy of their homes, or it can even be that Africans have the ability to combat the virus due to environmental differences between our various countries and those in the UK or in the US like myself. Our environment plays a big part in our health, and we're seeing that, take effect with COVID-19. Now, while the continent of Africa is having this strength in one area, we have weaknesses in many. And I think one thing that America specifically has shown us is how important leadership plays a major part in tackling the health and welfare of the economy. So, in my work with Better Way Passage, I've come across many clinicians in the diaspora that are looking to go back home, or some that are even already back home. I am originally from Nigeria. Those that are already home or wanting to go back home to improve healthcare in various aspects. However, the medical field isn't a place where it's beneficial to be a jack of all trades, as we say. And especially considering the different healthcare nuances that we may experience in various African countries. Dr. Hazel even talked about, something as simple as when a father passed away and the mother is not able to get land because it has to be given to the male child. We have so many nuances that play a role in different industries that can really put on a burden when it comes to clinicians. Inefficiencies in clinical education and training also account for what we like to call the brain drain. Dr. Musa pointed this out with Dr. Remy as well. The brain drain, which is individuals looking to practice outside of their country of origin. I've had this slide up for a while. This slide is actually a facility that my organization has been working with called IRDoc Nigeria, and that's Interventional Radiology Nigeria. IRDoc Nigeria is Nigeria's first clinically renowned vascular and interventional radiology facility. It was founded by Dr. Hamed Ninalowo, and IRDoc Nigeria was the first facility to conduct a prostate artery embolism in Nigeria. However, the tall handling of clinical, financial, administrative, and philanthropy duties of the facility is what connected Dr. Hamed and I. That also is what drives many clinicians to close shop and revert to clinical work in more established areas globally. And this is what we're looking to prevent. Really, how do we bridge the gap between individuals that want to do well, that want to see the progression of our various countries, but don't have the full capable means. And I think all the women on this platform have discussed so beautifully how they are making efforts and strides to really bridge that gap. And so one thing that we're doing with bridging the gap in leadership is to, work with organizations like that of IRDoc Nigeria. I personally take on the works of their philanthropic foundation and helping and assisting with marketing their facility, assisting with acquiring donations, and making sure that they have what they need to continue to progress and prosper within the workings of a country like Nigeria. And that is something that, I believe that we should all strive for. When it comes to working in different areas, different industries, doesn't have to be healthcare. You don't necessarily have to be the top of the food chain. I am, like I said in the beginning, I'm not clinical by trade, But being in the healthcare field for so long, my background is health administration, health information technology, and really having that understanding of international business management, I've been able to connect with different facilities like that of IR Doc Nigeria and see where there are loose strings and how we can help to push them up, and let the clinicians focus on being clinicians, rather than having to take on multiple tasks. And, to bridge the gap in leadership, we don't need a doctorate degree to accomplish that. It's simply having a skill set that can prove itself as valuable to another. And I'm going to leave this quote here. It says, "The most important breakthroughs rarely follow blaring trumpets and a red carpet. They are surprisingly fragile, passing through long, dark tunnels of skepticism and uncertainty." Look, when you're going into business, especially as a woman, we're often overlooked, often underappreciated, and that can cause a lot of self-doubt, a lot of questioning your motives and questioning your value and your ability. But we don't need to focus on that. Focus on the gift that you have been given and the opportunity that is in front of you to make a difference, no matter how small that opportunity is. If there's something you have the desire to do, be it in healthcare, be it in any industry, go for it. There's someone out there that values you, that values what you can do. Follow your dreams and invest in that. Invest in those that you believe in. And with that, I'll go ahead and end my presentation with that note of really just focus in on what you're capable of. Focus in on what your strong sets are, especially as a woman. I haven't had the glaring light or the biggest platform in regards to my nonprofit organization, but what we're doing is making a difference and making a difference for many. And that can be the same for all of us. So continue to strive, continue to push forward in all that you want to do.